The number one question that I receive from patients via the internet, online, or at my office is, how do I lose weight, Dr. Collier? Well, let's start off with this. Weight loss is an abnormal condition. Your body does not like to lose weight. Your body does not want to lose weight. Your body fights you along the way when you're trying to lose weight. One of the biggest problems with individuals is, as we grow older, our bodies become we have a lack of the appropriate compounds that are necessary to appropriately metabolize fat. So everybody remembers that when they were an adolescent, they could drop 5, sometimes even 10 pounds in 1 or 2 weeks, but just by altering their diet slightly. But now, as an adult, and sometimes particularly as you approach middle age, your body lacks those necessary amino acids to appropriately metabolize fat. So individuals will say, I don't understand why I can't lose weight. I'm not eating, yet I'm not losing weight. I'm going to the gym, yet I'm not losing weight. So we want to give you the supplements that can do that. At my weight loss facility, the number one supplement that we give to patients is an injection called Lipo-Bite. What Lipo-Bite does is make your weight loss predominantly fat versus a traditional calorie restriction diet, which will make your weight loss a combination of fat and muscle. Let's use an example of 15-pound weight loss. For every 15 pounds that you lose, you'll lose 10 pounds of fat and 5 pounds of muscle with a traditional calorie restriction diet. But if you gain the weight back by going back and resuming your regular eating, you gain back all fat. So even though the numbers on the scale may be exactly the same as your starting weight, your weight loss, and then back to that same weight, now your body has changed, your somatotype has changed, because you have a higher percentage of fat and a lower percentage of muscle. So your body is softer, less fit, and more susceptible to cardiovascular diseases such as high blood pressure, high cholesterol, and diabetes. Well, the injections that we give have L-carnitine, choline, and B12. Those are required to appropriately metabolize fat. The problem is that individuals have to come to the office to obtain the injection. Individuals have to come to the office to have the injection. And sometimes time is a phenomenon or a conflict. So we created the Lipodrops product. Lipodrops are taken sublingually, which means under the tongue. As you may be aware, a medication taken under the tongue is just as if you're given an injection, because it's not digested by the acids in the stomach in what's referred to as the first pass effect. The most common and simple comparison would be a nitroglycerin tablet. Everybody's seen people having chest pain, they take a nitroglycerin tablet under the tongue, they get relief in a matter of seconds. Well, with the Lipodrops product, you're going to have that type of absorption under the tongue. Again, the components of the Lipodrops, L-carnitine, choline, and vitamin B12, each a necessary amino acid and the vitamin that's necessary for fat metabolism. So the dosing is 1 dropperful under the tongue, hold it under the tongue for approximately 2 minutes, then swallow it. It's absorbed under the tongue, and in usually 1 to 2 minutes you've obtained the maximum benefit from that. Those products that are in the Lipodrops formulation will help with fat metabolism, so that your weight loss now becomes predominantly fat. So even once you lose the weight, your body will become more sculpted and you will have decreased body fat, increased muscle mass. So the Lipodrops product. The Lipodrops product was such a success that patients were taking it, losing weight, and saying, well, if 1 dropper will do, then 2 droppers will probably do better. They were taking a higher dose, and amazingly enough, were having better results. So we changed the formulation. We created the Lipodrops Max formulation. The Lipodrops Max is 10 times more potent than the original Lipodrops formulation. And we have found that, again, very safe levels. These are just amino acids and vitamins, so the dosing is appropriate. It's also compatible with any disease state. It's also compatible with any other medications that you may be taking from your physician. So the Lipodrops are safe, highly recommended, and will result in phenomenal weight loss for you. The Lipodrops Max for weight loss.